Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our Conversation with Cancer Experts series, we have a leading figure from the lymphoma world, Dr. Nina Wagner Johnston. She is professor of medicine at a institution that requires no introduction at Johns Hopkins University School of Medicine in Baltimore. And she's going to talk to us about some of the recent data that has come about in the first line treatment of mantle cell lymphoma and how it is, in the end, we'll discuss informing her practice. So, Nina, welcome.
Thanks for having me. I'm excited to be here.
So, Nina, so obviously, I think there's a lot going on in mantle cell, and there's always been this controversy, even in years before BTK inhibitors started coming about, whether you should transplant these patients or not transplant these patients. And but obviously, the data from BTK inhibitors is really changing the landscape of treatment, among other trials as well. So, I'll just ask you to review some of the key studies that have come about, and then we can chat on how you interpret these studies. Um, so to start out with, the triangle study. What was this study?
Yeah, so this led to a very big splash and honestly huge changes in our practice patterns for specifically for young patients with mantle cell lymphoma. So this trial, while a little bit complicated, it was really addressing whether the addition of ibrutinib, which is a BTK inhibitor, could impact outcomes. So the standard of care for young patients with mantle cell lymphoma has been to proceed with intensive chemotherapy followed by autologous stem cell transplant. So that's sort of your standard arm in the top blue box. Then they wanted to see whether the addition of ibrutinib to transplant would actually improve outcomes. That's the green box at the bottom. And then lastly, could we get rid of auto transplant altogether by just giving the intensive chemotherapy induction regimen and then following that with ibrutinib maintenance? And so the responses were somewhat surprising to us. If you go to the next slide.
Yeah. So what's the bottom line?
Yeah, so the bottom line was that it doesn't look like we need transplant anymore. Now, that's not across the board necessarily, but I think the major bottom line is that we do need BTK inhibitors in the frontline setting. They definitely improve outcomes. So if you look at the first graph, looking at failure-free survival, those who received ibrutinib actually did better than those who just got